Measure and record urinary drainage bag. Introduction. Patients that have a catheter will also have a urinary drainage bag. This urinary drainage bag will collect the urine and must be emptied at least once every shift. The bag will have a valve that will be open to allow the urine to drain out into a measuring container. The valve may be a T-valve that slides to the side to open, a push-pull valve, or a clamp valve. The evaluator will show you how to use the specific valve used in the testing center before you perform this skill. A catheter is a hollow tube inserted into the bladder to collect urine. A balloon on the end of the catheter is inflated with water once it's in the bladder to hold the catheter in place. The other end of the catheter is attached to the urinary drainage bag. The catheter and urinary drainage bag is a closed system, which means there is generally no opening to the outside to allow bacteria to enter. Once the catheter is inserted into the bladder, the urine runs through the catheter directly into the urinary drainage bag. There are 3 places that bacteria can enter this system: where the catheter is inserted into the body, where the catheter and drainage bag meet, and the emptying port of the drainage bag. When bacteria is permitted to enter the catheter system through one of the points of entry on the previous slide, the bacteria progress up the catheter and into the bladder, where they may cause a urinary tract infection, also known as a UTI. It is critical when performing this skill that the tube we use to empty the drainage bag does not touch anything. We want to limit the amount of bacteria the tube comes into contact with and clean it thoroughly after emptying it to prevent a UTI. You will be using an alcohol swab to clean the port tubing after you have emptied the drainage bag. It is important that you open the swab before you begin emptying the drainage bag to have it ready when you need it, because you can't let go of the drainage tube. You will need to place a barrier on the floor under the graduated measuring container before emptying the drainage bag. This prevents the floor from becoming slippery or contaminated if the urine spills. This also provides a clean place to put your clean supplies. You will definitely be exposed to body fluids during this skill, so gloves are mandatory. Put your gloves on before opening the valve on the drainage bag. You will be collecting the urine in a triangular graduate container that has measurements in cc's and ounces. In medicine, we measure in cc's. You will round up to the nearest line. Pay attention to the color of the urine and the odor. Report anything abnormal to the nurse. After assembling your supplies and putting on your gloves, open the alcohol packet. Remove the drainage tube from its housing on the urinary drainage bag and open the valve. Place the tubing over the triangular graduate container without letting it touch anything to prevent contamination. Empty the urine into the container and close the valve once the bag is empty. You will clean the outside of the drainage port with alcohol and then roll the alcohol swab into a tube and insert the tube into the end of the drainage port to clean. Wrapping the chucks around the urine-filled graduate container will help protect patient privacy and prevent spills. This will be set down on the lid of the toilet and the chucks will be unfolded. Do not set the graduate directly onto the toilet lid because the bottom of the container could be contaminated. Bend down to measure the urine in the container at eye level. Do not hold the urine container up to measure, as it will not be accurate and may spill. Urine must be measured on a barrier, on a flat surface, at eye level. The next slide will demonstrate how to read in cc's. The line above represents the top of the urine in this container, enhanced for easier readability. Round to the nearest line. This is 400 cc's. Body fluids that normally go into the toilet will be dumped into the toilet. The contents of urine containers will always be disposed of in the toilet. Then they will be rinsed, with the rinse water being deposited into the toilet as well. Finally, they're cleaned using the same cleaning technique we use for all patient use items. Make sure you check the urine drainage bag tubing and the catheter to make sure the tubing is not kinked and the patient is not lying on it. Make sure the tubing or the bag is not touching the floor or hanging in such a way as to become tangled in the feet of someone walking by. You want to make sure the urine is able to flow freely and the catheter will not accidentally be pulled out. Urine drainage bags should never be raised above the level of the patient's hips. This may allow urine to flow back into the bladder and prevent the bladder from emptying. This is a documentation skill. At the end of the skill, after the closing, you will need to document on the documentation sheet the evaluator will provide at the beginning of the skill. Record the amount of urine on the documentation form under Output. It is important to indicate the type of output as urine, because the body has many different types of output, including blood, emesis, stool, wound drainage, sputum, etc. Correct, accurate documentation is very important, especially with elimination. Nurses will often refer back to the intake and output sheet to see about the patient's fluid balance. If the patient has had more intake than output, that can indicate a serious medical condition. Patients with more output than intake are at risk of dehydration. Make sure you document correctly. This is a sample documentation sheet. Notice the output form near the top of the page. You will indicate the time, the type of output, the amount, and your initials. Finally, sign the form. Watch the instructional video for step-by-step instructions on how this skill is performed. Then try this skill on your own.